The number of migrants quarantined for mumps at immigration detention centers continues to rise. The number of cases has gone up from 236 to 334 since March of this year. ICE officials say nearly 5,200 migrants have been quarantined across 39 detention centers. CBS News has reached out to ICE but has not heard back. So joining me now is immigration reporter for the Washington Post, Abigail Hauslohner. Thank you so much for joining us, Abigail. We have talked about this mumps outbreak, and I see it's on the rise. The expectation is that the numbers are going to continue to go up because they don't have a handle on this yet?
That's right. Well, mumps is highly contagious, the CDC says, and we're talking about an outbreak that's taking place in these very, very crowded detention centers. Already a situation like this is sort of prime for the spread of any infectious illness. And mumps, as we know, we don't hear about mumps very often in the United States. That's because most people are vaccinated against it. It's covered by the same vaccine that covers measles. But when you have anyone who's not vaccinated, and especially people in close proximity, then you have a population vulnerable to a serious outbreak.
So this is obviously concerning for the people that are being held at these detention centers. But you just brought up something about the mumps vaccine is the same vaccine that covers measles and rubella, I believe. As you know, we are dealing with a measles outbreak here in this country, partially because many people have decided not to get that MMR vaccine. So you have detention workers that are coming in and out of that detention center that work there and then go home. Are they at risk of catching the mumps and then, bringing it back out?
Yes, they are if they're not vaccinated. And the vaccine, of course, we should say, is not 100% preventative. You can still get the virus, although the vaccine is largely effective. ICE has said that it is worried about its personnel. It's asking them to take precautions. And, I've certainly talked to other Homeland Security officials, folks who work with the Border Patrol, who are worried about similar things about infectious diseases, because right now, the Department of Homeland Security across different detention facilities is holding a huge number of people in very close quarters, far beyond their regular capacity in many cases. And so it's not a great situation to maintain good health.
So some of the countries that the migrants are coming from actually have vaccination rates that are equal to the U.S., but we're still seeing this bump in cases. Is it because of what you brought up, that sometimes the vaccine isn't necessarily 100%?
I don't think the ICE has identified the cause just yet, but what we've seen from certainly mumps outbreaks in the past in the United States, and I should note, there are mumps cases in the general population right now. It's not just in ICE facilities, and they're not all necessarily related. But mumps is contagious enough that I think it really only takes one or two people to start an outbreak in a small or close-knit community. Certainly we've seen that in the past. So I don't think we necessarily know how much of the population in these detention facilities have been vaccinated. Certainly a lot of people are coming from very rural areas in Central America, in Guatemala, El Salvador, and Honduras. And the rural areas of those countries where people are very poor have less access to good health care than people in cities. But we don't know what their vaccination rates are.
Now, I don't know how mumps is contracted, whether it's you cough or what it is, but is anything being done in these detention centers to at least limit the exposure to the people who are healthy?
What they're doing is the same protocol they follow with any infectious disease in Homeland Security detention. And they are quarantining anyone who is showing symptoms or who they believe to have been exposed to mumps. So far, they've quarantined actually more than 5,000 people recently after they believed most of them were exposed. Some of those people, about 800, they believe were exposed to chickenpox, also highly contagious. Many of us had it as children. And also, not fatal, but can be very problematic in a crowded situation.
Definitely. Abigail Hauslohner, thank you so much.
Thanks for having me.